Here in Hawaii, we have some of the best diving in the world, which also puts divers at risk for the bends or decompression sickness, which is why the University Health Partners and John A. Burns School of Medicine find it crucial to have a hyperbaric chamber available at all times.
So hyperbaric oxygen therapy is giving 100% pure oxygen in a pressurized room or tube. We increase the pressure to about 3 times normal atmospheric sea level pressure, and that allows us to get very high concentrations of oxygen into the lungs and into the bloodstream. We have a lot of divers in Hawaii, not only recreational but commercial divers, researchers, the military, and we serve as a primary emergency treatment center for all of the public here in the Hawaii and the Pacific Rim. So it's very critical that we have that, and we're lucky to have one of the few hyperbaric chambers in the country really that are available 24/7. The next nearest hyperbaric treatment center is 5 hours away in San Diego. So it is critical that we have this resource here in Hawaii available to patients who need it right away. We have a multi-place chamber, so we can accommodate multiple patients or very sick patients that need additional treatments or IVs, things like that.
Patients initially were treated because they had dive injuries, and then we realized that they got better because they had more oxygen in their bloodstream, and we extrapolated that to other diseases where patients had impaired blood flow or had injuries or had infections, and therefore we've learned that it's useful for multiple different things, from wounds that won't heal, radiation injury, from treatments that patients need for cancer, inflammatory bowel disease, and carbon monoxide poisoning. Not only does it get more oxygen to the places that need it, it also stimulates things like growth factors and stem cells to help heal wounds, help improve the overall blood supply to certain areas that may have impaired blood supply, things of that nature.
Back in the year 2000, I had stage 4 throat cancer, and I had what you call an occult tumor. They had to shotgun radiate the whole side of my face, and it was very traumatic on the tissue. In 2010, I came down with a jaw infection and had some dead tissue, and I went through the 40-day treatments out of 50 days, and the infection was gone, and I was basically healed. Feel better physically, mentally, feel stronger, and it helps different patients in different ways.
Quite honestly, people seem to feel better in the chamber, and it's one of those few medical treatments where people sometimes feel better after than before.
Sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.